Hi, I'm Dr. Kurt Woeller. Let me talk a little bit about how to treat autism. Now, we know that there are many different types of services that are available for individuals on the autism spectrum, from young children who go through applied behavioral analysis, ABA therapy, to speech therapy, to occupational therapy, working on motor function, gross motor function, fine motor function. And there's other types of therapies too, horse therapy and whatnot, that provide more sort of environmental stimuli for a lot of kids on the autism spectrum. And certainly as individuals get older, become teenagers and adults, some of these services are still applicable, but unfortunately as people get older too, the access to some of these therapies just isn't there, because in many states and in many areas in the country, many of these services like speech, like ABA therapy or occupational therapy, are actually implemented through the school district. So it really depends on where you are. Now, with respects to adults on the autism spectrum, unfortunately, there's not a lot of good therapy. In many cases, either adults are in homes or they're put into institutions and sometimes put on various medications to try to deal with some of the behavioral problems. So from a traditional treatment standpoint, most of the medications that are used in essence to try to minimize, if you will, some of the behavioral problems. The one FDA approved medication called Risperdal is actually the one medication that is used specifically for the treatment of autism, to deal with, in many cases, with aggressive problems and antisocial or aberrant behavioral issues that many individuals on the spectrum have. Now, some kids and some teenagers and adults I've seen are put on what are called SSRI medications, Zoloft sometimes, or things like Paxil or even Prozac, to help with some of the mood issues as well. And there's a wide variety of other medications too. So, but the main medication treatment that's FDA approved is Risperdal, and from there, essentially what you're left with is behavioral therapy, young children's speech therapy, occupational therapy, etc. So treatments for autism are pretty limited from a medication standpoint, and you're really dealing more in the realm of non-medication treatments to deal with some of the social, language, and behavioral problems. Thanks.